Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have a very famous doctor from Mumbai, Dr. Aditi Shah. So she is the founder of Small Wonders Children's Clinic in Santa Cruz West. But then she's associated with a number of hospitals in Mumbai. She's done so many educative sessions like these with various groups, and she's so excited to talk to you about teething. So I think that is one issue I keep getting queries about. My baby is constantly irritated and suddenly pulling himself and shouting. So what is it? So I think Dr. Aditi Shah will be able to clear all your doubts today. So yeah, I think you can start putting in your questions right away. Then ma'am will start her talk now, and I'll take up the questions. Over
Thank
to
you
you,
so
ma'am.
much, Surya. Yes, and thank you, iMumz, for giving me this opportunity to interact with such lovely mothers today afternoon. And hi to all the mothers. I hope that what I'm going to take as a 1 hour session on teething helps you ease your trouble related to your child when your child is not well at the time of teething. So teething is a natural, normal process where the child who's around 6 months old or more starts getting his teeth. So when I say it's a natural process, it means that it is going to happen without any help at all from anyone, from you or from your doctor. It is going to happen irrespective of whatever medicines are going on, and it is going to happen irrespective of what you do or you don't do. So this means that it's a milestone. A milestone is something which the child achieves on his own. Now, generally, the process of teething starts after 6 months of age. At this time, the child starts getting the gums to be a little bit sore. Sore means they don't like the feeling of the swollen gums. You may not see the swelling of the gums, but they are swollen from inside. And when that feeling comes, they like to put everything in their mouth and try to chew so that that sensation of soreness goes away. So you must have noticed your 6-month-old babies putting everything possible, including their own fingers, sometimes even their toes, into their mouth and keep chewing. They also, whatever comes in their hand, may it be your finger, may it be your handkerchief, may it be their own clothes, they just start going in the mouth all the time. And the reason for this is that they feel comfortable when they are chewing on something, that soreness in the gums goes away. Now, why do they get this soreness? It's because the underlying tooth is trying to come out. Now, as you can expect, only when the tooth is sharp enough and healthy enough, it can break the gums and come out. Now, when that tooth is making such an attempt to come out, naturally, the gums are going to get a little bit of pain. You may be surprised to know that many babies go through the process of teething without any pain or problem at all. So it's very good if that happens. But what if the babies are cranky, irritable? So it is the time of teething when because the babies tend to put a lot of things in their mouth, and plus because their immunity is still not fully developed, that they tend to fall sick. So they may get a little bit of fever, sometimes loose motions, occasionally vomiting. Their feeding may go down, their appetite may go down. The food that you have started at 6 months, apart from milk, they may not accept very happily, especially just a few days before the tooth starts erupting. They become cranky, especially more in the night. So they cry, and they need to be given certain medicines for relief of pain. Now, many parents come to me asking, Doctor, what to do? My child is so uncomfortable. So it's important that you remember that some amount of discomfort is going to be there, and there is no need to do anything to relieve that discomfort. There are many gels and dental preparations which are available in the market, but from various studies we know that they are not at all useful, and most of the times not even needed. But if the child is very irritable, especially evening and night times, which is affecting the baby's sleep pattern and feeding pattern, you can visit your doctor, and your doctor will prescribe you very basic painkillers, which are oral medicines, something like paracetamol, which you can give to your baby only and only if required, not as a regular basis. Also, there are many preparations in the market which are given to mothers who have children who are teething, and also things like strings with a stone tied in the center, which they are told that if they tie this to the baby's neck, then the baby will not have any problems with teething. So we all know medically that these are not at all required. A basic amount of calcium and vitamin D preparation, which your child must already have been, is all that the baby needs in terms of medicine for healthy teeth to come out. Now, this is the first process of teething, where around 4 teeth should be there by the age of 1 year, and every child will have their own pattern of teething. So, one child at 1 year may have all 6 teeth, one child may have only 1 or 2 teeth. So, that pattern is going to vary. So, don't compare your child with somebody else and ask as to why my child doesn't have teeth. If your child has even 1 or 2 teeth at 1 year, it is acceptable, it is okay, and you don't need to do any tests, or you don't need to get worried, because teething is naturally going to happen even if it happens late. The other time of teething is at 6 years. That is the time when the primary teeth fall and the secondary teeth come. That is actually a time of celebration, because I know the child is so happy that his teeth have fallen, and the tooth fairy will come and take his teeth away, and the mothers are happy. It's almost like celebrating, because it's a milestone in their child's life, the first tooth falling. I know all of us have our own pictures when we were small, when our first or 2 teeth have fallen, and our mothers have taken our pictures. So we all do that with our children as well. So that is the second process of teething. In between these two is the most important phase, where we have to teach the child how to take care of his teeth. So I always mention that it is important that as soon as the child gets his first tooth, the process of brushing or cleaning the teeth can be started. What brushes to use, you can ask your pediatrician, your doctor, they will advise you. There are different toothpastes available for different age groups, so even that the doctor can tell you. Generally, for children less than 6 years, we prefer toothpaste which have low fluoride content. And after 6 years, you can use the adult toothpaste, which has a normal fluoride content. This is in order to help the teeth, the outer part of the teeth, that is the enamel, to grow properly. Also, it is important as to how much of toothpaste to use on your toothbrush. So it's almost less than, for children less than 2 years, use only a pea size, such a small amount of toothpaste on the center of the toothbrush. Make a smear and let the child take the brush and play with it. Even if the child keeps on playing with it, he's going to brush his teeth on his own. Many times parents ask me that what happens if he doesn't know how to spit it out and he swallows it. So there is no problem, since you're anyways using such a small amount of toothpaste, and baby toothpaste are not known to have a lot of frothing lather or anything. Even if a little bit of toothpaste which is there in the mouth and the baby swallows, nothing is going to happen. But you can use a handkerchief which is dipped in water and clean the teeth if the baby just is uncomfortable with the toothpaste in his mouth. This brushing has to be done twice a day. If your child has a habit of grazing or eating something all the time, every 2-3 hours he has the habit of eating something, then I in fact recommend that the child should be encouraged to clean his teeth after every meal. At least, if not brushing, but at least cleaning with water is very essential. So with this, I will stop my talk, and Anusia, we can take the questions on teething.
Yes. So, everyone, do post your questions on the chat box. And till then, I'll take up the questions that we have. I have a question here. Hi, ma'am. I see that the symptoms tend to get worse in the night. Like baby is fine and playing during the day, and when it is time to sleep, that is when baby starts to get cranky and crying and all that. So, why does this happen,
Yes.
and is there anything we can do to stop it?
So the reason is the same. Even when we have some pain somewhere, you must have noticed that when we are busy throughout the day, it doesn't come to our notice, but only in the night when we are resting and we are going to sleep, that it comes out. Same way in the babies. Also, the parents are more busy throughout the day, so they may not notice the certain things that the baby has been doing, like putting things in the mouth, drooling, or getting the saliva out, chewing onto everything, biting people, and things like that. In the evening and in the night, this pain is generally, it normally tend to be a little bit more, And for that, like I said, we do prescribe a small dose of paracetamol, which is a painkiller only for those babies in whom this pain is uncontrollable and the baby is extremely uncomfortable. The other thing that I tell the parents to do is start using teethers. They can use teethers which are available at home also, something like wooden toys which can be washed and sterilized. Even small spoons which are made up of steel, which don't have any sharp edges, those can be used. The child can take it in his hand and keep biting on it. Even that relieves the pain to a certain extent. Sometimes there are some teethers which are available in the market which have gels inside, so they are jelly like. I generally advise my parents to avoid those because those are the ones which cannot be sterilized or boiled, because sometimes they tend to burst and the gel tends to come out. So plain plastic or wooden teethers are what they can buy. Sometimes I also say one thing, that you can keep the teether in the fridge for 5 minutes, let it become a little bit cold, and then give it to your baby to bite. That is even more soothing for the gums. So these are the things that we can do for the pain.
Thank you, ma'am. Ma'am, Isha is asking, how do we know when the teething is about to start? What are the symptoms I should be looking out for?
So the process of teething, Isha, starts somewhere after 6 months of age. You don't need to look out for any signs or symptoms, but you will automatically notice that by this time the child also develops what is known as a hand to mouth coordination, which means that they know that by doing something their hand reaches their mouth, their hand reaches the ear. So you will notice that he keeps on touching the ear and putting things in his mouth. When this becomes much more vigorous, like, whatever comes in the child's hand, and if he doesn't find anything, then it is his own finger or fingers. So they tend to put the whole hand also inside their mouth. Sometimes even their toes, they turn the leg up and they put their toes inside the mouth, and they try to keep on chewing. If you see that your child has started doing this, that means the process of teething has started. When they start chewing onto things, they also start producing more saliva. So they keep on drooling. So you will notice that your child has started drooling a little bit more. Sometimes as he comes closer to the time when the teeth will come out, he may get a little more irritable and cranky, especially in the evening hours or in the night time. Even at that time, it's very difficult for the doctor also to tell you exactly when the teeth will come, but that is not needed. But most of the times, after the child becomes very irritable, in the next 1 or 2 days, you will start noticing nice white pearly teeth. Most commonly, they appear in the lower two gums, and the next two that appear are most commonly the upper two. But it's not necessary that this pattern is followed. Any two teeth or any set of teeth can come at any point of time. So what we say is most often by 9 months to 1 year, most babies have about two teeth. Anushya?
Yes. Thank you, ma'am. Uh, so I think you've already answered this question. Saubhagya, ma'am has just taken this up. Ma'am, can we use teethers? And is there any recommendation for a teether? Is there any specific recommendation for a teether from you, ma'am?
So all I can say is, if you go on all the baby sites online right now, because I don't know how many shops are open, you will find a whole list of teethers that are available. If you want to spend money, you go, and whatever fits your budget is fine. But like I say, if you just have something at home in the form of wooden toys or spoons or simple plastic teethers which the child can hold, that is very important. The child can hold and put in the mouth is good enough. There is no specific recommendation for what kind of teether to use. But avoid teethers which have gels inside. That's my only recommendation, because gels containing teethers, when you sterilize them or put them in boiling water, some of them can break and the gel can come out. So those teethers you should avoid.
Thank you, ma'am. Ma'am, I think there is one question I see that is very common that I keep seeing often. So, Afroj is asking, my 9 months old baby still has teeth, but bites a lot while breastfeeding. Please help. And even those who have already had a little one or two tooth, then they also seem to be biting. So, is there anything they can do to stop this?
So that is a very common problem, and we know that most often uh, you will have to bear the pain. If it is really hard, then you can try to disengage your baby from feeding, and then again try to feed the baby again once that soreness in the gums goes away. Of course, if the bite is causing an injury, then please apply antiseptic and antibiotic lotion so that there is no chance of infection. The other thing that I suggest is just before putting to feed, you can try to give your baby a teether for some time, for 5 minutes or so. So he just bites on it and gets relieved of that uneasy sensation that he's getting on his gums, and then put him to breast. That is one way that you can stop the child from biting you. The other thing we've seen that these children, once they get into the habit of biting, they bite you everywhere. We have had cases of mothers having bite marks on their neck as well, because when they're carrying their baby on their shoulder, the baby finds even the neck very nice to bite on. That helps his gums feel so better. Your fingers, so many mothers coming and saying that he just takes my finger in his mouth and starts biting. So those pains can still be okay, but I understand that when there is a bite mark on the nipple or on the areola, it can be extremely painful. So there are ointments and creams available. If you need for relieving your pain, you can put them, such as Nip Care, and there are also creams like T-Bact and Mupirosin, which are antiseptic creams which can be put. But frankly, till your child gets teeth, there is nothing that can be done to stop him from teething, from biting. Very common. Unfortunately, very common.
Yeah, I think this is a very good tip. They give a teether first so that they can do all the biting and then
It
take
helps.
milk
It helps
later.
sometimes. It does. Yes.
Thank you, ma'am. Ma'am, Kavita is asking, when would we start the brushing with paste for baby? I think you mentioned it in your talk, but she would have missed it. So,
So I'll say it again because that's very important. When your child gets his first tooth, start using a finger brush. There are finger brushes which are like a plastic which you can put on your finger. The first 1 month, just clean with that with your hand. And while you're cleaning the tooth, you can just simply clean the tongue also. There is no need to have a very elaborate entire cleaning for such a small baby. The reason is that their saliva is itself an antiseptic, and therefore it takes care of a lot of problems and other things which can happen in the mouth. You don't need to clean the baby's mouth very vigorously. But using a finger brush is a good idea, and quickly just clean. After 1 month gets over and the child is comfortable with somebody putting a finger brush in his mouth, then you can start using a baby toothpaste, which is a fluoride free or a low fluoride containing toothpaste. So when you see the cover of the toothpaste, it should be written fluoride free or it should be written low fluoride containing toothpaste. And then you can start using this and you have to form a smear on the finger brush and then start cleaning the
I
teeth.
think we lost you in between. You had
Oh,
a
I'm sorry.
network issue. So, yeah,
Can you hear me now?
we can hear you now. Yeah.
Yeah. So use a little bit, a very small quantity of this fluoride-free toothpaste or low fluoride containing toothpaste on the finger brush and brush. Use a handkerchief and just clean it up. As the baby gets more teeth, then you can start shifting to a soft bristles toothbrush, which is a small brush with very soft bristles, and use a very small quantity of toothpaste, which I mentioned, as small as a pea or even smaller than that, and clean the mouth, clean the teeth with it, and then rinse the mouth if possible. If the baby doesn't know how to rinse the mouth, just wipe the teeth and the tongue with a handkerchief. Do this 2 times a day so that baby gets used to the process of brushing. So I've had many mothers who've come to me straight away at 2 years, have never brushed their children's teeth before. And at 2 years, when they introduce the toothbrush, the baby just refuses because the baby has never been trained and has never been used to this whole idea of putting a finger brush in the mouth or putting a toothbrush in the mouth. So they don't like it. They start gagging, they start feeling like vomiting. So I suggest that as early as possible, you can start cleaning the baby's teeth. Even after the first tooth appears, you can start using a finger brush and start the process of cleaning. So that's what I would suggest.
Thank you, ma'am. Ma'am, Archana is asking, my baby is about to complete 4 months. She chews her toys and always puts her fingers in the mouth. Is this the start of teething? And I've also seen queries from moms. We've already fed And then after that, they are putting the hands in the mouth, and everybody is saying baby is still hungry. So, yeah,
So to
how do you
answer,
deal with this?
yes. So to answer the second part of your question first, so even for newborn babies, we know there is a reflex known as sucking and rooting reflex, which means that even if you just tab on the baby's cheek, the baby tries to look for your finger and tries to put your finger in his mouth and start sucking. This is the reflex which the baby has got from God, and that is because that is the only thing that is a survival instinct for the baby. The only thing that the baby can do is to suck and to feed. So that's why please remember that this movement of trying to suck everything does not always mean hunger. It is just a reflex which God has given babies. It can happen to the baby even when the baby is near the mother and touching the mother's breast. It can happen even with your finger. So please remember that has nothing to do with hunger. Hunger can be expressed by crying, and of course, if you know that the urine output is fine, then that means how much milk you're giving is enough. But just the process of sucking is not related only to hunger. Coming to the first part of the question, that even a 4 or a 5 month old baby has this reflex of sucking. Plus, they also tend to get the understanding of hand to mouth coordination somewhere around 5 months, which means that they come to know that their hands reach their mouth. After 1 month, they come to know that their hands reach their ears. So when they come to know, it is like a exploring. It's like fun. They come to know that my hand can go in my mouth, and oh wow, that is such an exciting thing to do. So they tend to do that a lot. And again, that may not be the sign of teething. It is just a reflex that they have got. When they start doing it persistently at 6 months, 7 months, they keep on doing it so much so that the mother has to actually remove the baby's hand from the mouth to stop him from gagging and from vomiting. So that is the time when we suspect that okay, this is happening because of teething. Also, when they tend to put their fingers in the mouth, if they are comfortable, I always advise the mothers not to remove the fingers. It's a comforting thing for them. So as long as they are not gagging, they are not feeling like vomiting, it's okay. Let them enjoy their own fingers. Don't try to keep on removing the fingers from the baby's mouth. It is really not needed. Also, the process of thumb sucking, many of babies develop at this time. So at this time, let them do it. It doesn't harm them in any way. The habit is not going to go even if you remove the baby's finger from the mouth again and again. So I always advise my parents that don't be in a rush to just remove that hand from the mouth. Let it be. It's comforting your baby. As long as he's not vomiting, you don't have to do and rush and do anything. The habit can be removed even later.
Absolutely. Thank you, ma'am. Ma'am, Kavita has one more question. She says, I see only one tooth clearly popped out from the bottom of my 7 months old. Should it be two always? Like, should there be two eruptions or one is okay? Should I be bothered?
So no, Kavita, there is no pattern. Like I said, even if one tooth has come, that means that the child has already gone into the natural process of teething. And if one tooth has come, the second will come very soon. It may not be necessary that the second one comes right next to the first one which has come. Even the upper teeth can start coming. So the pattern is not fixed. Any two teeth in the mouth by the time the child is 1 year is good enough. And then later the teeth can come as and when the teeth are fully developed and are ready to come out. That's when they will eventually come. But one tooth at 7 months is excellent, Kavita. It's absolutely good. Your baby is fine.
Thank you, ma'am. Ami has a very relevant question here. She says, "Is it recommended to give edible teething sticks? I'm always worried about choking. So there are a lot of variety in the market right now. Many brands promoting teething sticks. So what are your thoughts on this?"
So if the teething stick is free of any medicine and it is not going to be chewed off, it is just like a teether, and it can be washed and it can be sterilized, then you can use it. But if there is any chemical medicine applied to it, if it's difficult to wash or clean them, if you can't sterilize them, there is no need. Teether is good enough.
Thank you, ma'am. Ma'am, Smita says, my baby is 7 months old. Still, there are no signs of teething. At 3 months, he always wanted to chew everything, so we thought the teething has begun. But till now, there is no tooth that has erupted. What to do?
So many children take their own sweet time. for teething. It's similar to all the other milestones. So, there are some children who start walking at 9 months. There are some children who walk only after 15 months. There are some children who, in fact, start talking. They start expressing themselves as early as 1 year. Some children start crawling by 6 months. So there is always a variation in these milestones, and that's why a pediatrician will always look at your child with an understanding that this range is different. So it's not necessary to say, okay, your child is not yet crawling at 9 months. The other child is crawling at 9 months. That means your child has a problem. No, not at all. Same way for teething. So if your child has started with biting and everything as early as 3 months, like I said, most often it was just a reflex. The actual process of teething must have started just about a month back, where he must have started doing it much more. So the process of teething starts. The teeth will come in anywhere between 2 to 3 months, and by 7 months, not having any teeth is not a problem at all. Like I said, we have to wait till 1 year. Until 1 year, if your child has 2 teeth, that is good enough. Also, I would recommend that don't keep looking. If your child is drooling, if your child is biting, that every single day there is that hunt. Okay, daat aaya kya dekho. So don't keep looking. The teeth will come, and when they come, they will be nice and healthy. They have to come on their own, and they have to make their own attempt to break the gum and come out. So they will come only when they are ready and only when they are healthy. So don't worry, they will come.
Thank you, ma'am. Ma'am, Mayuri has this question. My baby is 4 months old. She is chewing her hand. She's screaming so much, and she's so irritated the whole day. So, can this be counted as a sign of teething?
So, Mayuri, I would suggest that please look at other things also. Like, is the child getting appropriate amount of feeding? Is the child sleeping well? So, sleep pattern and feeding pattern. Keep a watch on how the child's weight gain is. So, your doctor will be able to guide you. Is the child gaining weight as per the requirements or not? Which will be another way to see if the child is getting enough milk. Look if there are any other things which are troubling the baby. Like, are you swaddling very tightly? Are you keeping the baby in a very hot environment? Also, things like there are certain materials which are used for the baby's clothing which are not comfortable. Are there any rashes on the body? Are there insect bites? Are there any other things related to the scalp? Sometimes inside the hair they have these small cradle cap or some flakes coming out which are troubling the baby. So try and find if there are other things apart from teething which are troubling your baby. Many a times also there are some babies who cry only to be picked up. They are those smarter ones. So in fact, they are the ones who cry as soon as you pick them up, cuddle them, carry them around. They want your attention, and then suddenly they are fine. So those pains are not really teething related pains. So you have to look at all these 4 5 things which I mentioned, especially since your child is only 4 months old. It may not be related to teething alone.
Thank you, ma'am. Ma'am, Sapna is asking, my baby is 2.5 months old and he's having white patches inside his mouth. I maintain oral hygiene. Is the white patch a sign of teething?
So many children have a remnant of the milk left behind on the tongue about an hour after feeding. It starts becoming fader and goes away. Also, by the time it goes away, the next feeding cycle anyway starts. So the child again gets that small white, thin patch of remnant of milk on the tongue or inside of the cheek. That is normal, and that does not even need to be cleaned. If you're cleaning that, don't do that. It's not required. But if there are persistent white thick patches over the tongue or on the inside, then it could be a sign of a mild fungal infection, which we call as oral thrush. Now, oral thrush is a fungal infection which needs to be treated with certain medicines which have to be applied on the baby's mouth, and also that can be a reason why the child may not be very happy feeding or sucking, because it can sometimes be painful and he's cranky because of that. But those white patches have nothing to do with the process of teething. Also, when we find oral thrush in a baby's mouth, especially if it is happening again and again, we try to find the focus. So you may find mothers who have fungal infections on their breast or on their axilla or on their hands, which they by unknowingly are transferring to the baby. Sometimes if they are bottle feeding, then the bottle may not be, the nipple may not have been washed properly, The tin from which they are taking the milk, that tin must have been old, and therefore look for the expiry date. So what we try to do is like try to find the source of this fungal infection and treat that as well. But these white patches have nothing to do with teething. The crankiness is similar to teething because it can sometimes be painful, but it is not because of teething itself. So please visit your doctor. He will guide you as to what medicine to apply.
Thank you, ma'am. Ma'am, Manika is saying my baby's appetite. Okay, does baby's appetite decrease during teething? Are there any other symptoms or problematic things for teething which we as parents should be aware of, like stools, etc.?
So during teething, the baby tends to put his hand or other things in his mouth, whatever comes in his hand, all the time in his mouth. So because of this, they are known to catch infection. The process of teething itself will not give rise to fever or infection. At the most, it can cause pain. But because they put things in the mouth which may not have been very clean, or some surfaces also, such as handkerchiefs and clothes, which may have touched something which is not clean, and if they put that in their mouth, then they are known to get infections such as gastroenteritis. So sometimes loose motions, vomiting, and even related to loose motions and vomiting, they can get fevers. Some children also tend to get respiratory infections such as cough and cold at the time of teething. But like I said, it is not because of the process of teething itself, but it is because of this constant irritability and wanting to put things in their mouth which may not be clean and carry infection to the baby's mouth and to the baby's body. But yes, of course, and one more question: does appetite decrease with teething? So at the time of teething, some children do tend to avoid one or two feeds or avoid eating solid food. But within a period of a few days, as soon as the teeth erupt, the appetite comes back.
Thank you, ma'am. Ma'am, as you mentioned, when babies start teething, they try to suck the feet, like fist, and put the feet also in the mouth and everything inside the mouth. So Shweta is saying baby is about to complete 4 months, and he started to suck his fist as well as his toes. Should I give him a teether now? And what teether? I think that ma'am has already answered that any teether is fine, but should we introduce a teether at this age?
So I'll guarantee you one thing. At this age, even if you give your child a teether, he will throw it away and he will still prefer to suck his own fist. Because you never know, it may be really so tasty. This is such a common thing that we notice that parents say कि doctor हमने इतना पैसा खर्च करके we got so many different designer teethers for our child, and when we give the teether to our baby, वो छोड़ देता है and he just keeps on sucking on his own hand and fist. So all I can say is you can give a teether, but I think till 6 months, if he prefers to suck his own fist, let him do so. There is no harm. It comforts him. It gives him relief from the soreness, and also it is a reflex. So at 4 months, if he's doing it, it may be just a part of the reflex, and let him do it. You should allow them to explore their own body. Many a times I notice mothers using mittens. So I always tell them, don't use mittens we are at home when you're watching your child, because then they learn to use their hands faster. It's all right. If the nails are big and they start scratching, then cut the nails, but don't use the mittens. Let them explore their own body. So teether, if you want to introduce, okay, but I think you can easily wait till 6 months. There is no rush. Even after 6 months, he will still prefer to use his fist, for all you know.
Thank you, ma'am. So Khushbu is asking, will nipple shields help in case baby bites while feeding?
They Yes, they do, but babies are so smart that if you've never used a nipple shield before, and now at 6 months or 7 months when the baby starts biting, if you use a nipple shield, the baby will not accept it, may not accept it as a substitute for breastfeeding. But yes, you can use, if you have, especially if you have wounds, then please use, because I know that time breastfeeding becomes extremely painful. And if you're still you are a good mother and you still want to give your breastfeed to the baby, but that pain is just not bearable, then yes, please use a nipple shield, so that by the time your wounds heal, you can let go of the nipple shield and continue breastfeeding again.
Thank you, ma'am. Ma'am, Smita is asking, when should I teach my baby to swim? He non-stop cycles while his legs while in the bathtub. He is 7 months old. And also she wants to know how much breastfeed does a 7-month-old need and how to increase the supply.
So if the baby is 7 months, at 6 months, you have already started with solid food. But please remember that is just weaning. Weaning food means that it is a in addition to the breast milk. So that goes plus breast milk goes. So at 7 months, how much amount of breastfeed is enough is decided by the baby. That is why we call it demand feed. As and when the baby wants, you give it. It is irrespective of when the baby has had solid food. So many babies immediately after solid food also demand breastfeed. So we always encourage the mothers to give it. There is no problem giving a breastfeed immediately after solid food. Now, whether it is sufficient or not, you will come to know only when you see the baby's weight when you go for your monthly visits to your doctor. If the weight gain is as per requirement, that means what you're feeding is good enough. Whether you should introduce a top feed or not, it depends upon how much milk you get and do you feel that you don't get enough milk that the baby requires. Only then we can introduce top feed. Otherwise, there is no need to introduce top feed at all. Breastfeed is good enough for as long as 1 year. Many mothers are known to only breastfeed and not introduce top feed to the children even up to 1 year, because at 6 months you have already introduced solids. So the hunger part can be taken care of by the solid feeding also. Breast milk is like amrit for the baby. So whatever amount of time that you can breastfeed the baby, it is only going to be beneficial. How much, as I said, depends upon whether the baby's weight gain has been adequate or not. When can you introduce swimming? So that is a very abstract, actually no medical definite recommendation is there for age at the time when you can start the process of swimming. But yes, after 6 months, for a few minutes, if you want to just help your child get into the pool and dangle his legs into the water, it's fine. But till 1 year, I recommend not to put the baby for a very long time in water, especially swimming pool water, because we know how dirty it is. By 1 year, the baby has finished most of his vaccines, including the hepatitis A vaccine, which is a waterborne disease. So after 1 year, fine, a little longer time of exposing the baby to the swimming pool is allowed. When to actually start teaching is really no recommendation. Whichever time you and your baby are comfortable, but after 1 year, you can start trying. But generally, till 3 years, most of the places where swimming pool coaching is offered don't take children less than 3 years.
Thank you, ma'am. Ma'am, Manika has one more question for you. My 9-month-old baby does not crawl. He doesn't enjoy tummy time much. When we put him on tummy, he just moves forward by shifting on stomach itself. He wants to stand all the time with support. Does that mean that he would skip crawling?
So nowadays we do not consider crawling as an essential developmental milestone, because, like you said, most of the babies after 6 months when they are comfortable sitting, and then by 8 months when they are sitting up on their own, or by 9 months when they are sitting up from lying down position, they come to sitting position. After that, they tend to straight away start walking, holding and standing, and start walking. So even if your child is not walking, not crawling by 9 months, it's fine. But the next milestone should be achieved well. So somewhere around 10 months, he should be able to hold on to furniture and stand up on his own. By 11 to 12 months, he should be able to hold furniture and walk a few steps. And by 1 year, he should be able to stand momentarily, at least, without any support, and walk a few steps if possible. By 15 months complete, he should definitely walk a few steps without holding anything. So this is the step in which if your future milestones are getting achieved, then you don't worry about your 9-month milestone of crawling not being achieved. It's all right.
Thank you, ma'am. Ma'am, Swati is asking, my baby is 10 weeks old. Can we clean the tongue with a cloth?
How old? Sorry, I did not get the question. How old is the baby?
Baby is 10 weeks old.
10 weeks old. There is no need to
Correct.
clean at all. There is no need to clean the tongue. Uh, Before, after feeding, there is no need to clean the tongue at all. Breastfeeding itself is a very continuous process, so it's causing formation of lot of saliva in the mouth. and that saliva is an excellent antiseptic. And as soon as the baby is swallowing, the fresh saliva starts forming, and that's why you don't need to clean the baby's mouth at all.
Thank you, ma'am. Darshana says, my baby is 5 months old, and since last night, he isn't sleeping if I'm not holding him. He had slight fever in the morning, and he has been so cranky, and he has not pooped since yesterday, and he's super clingy. So, like as soon as she tries to, remove her breast, then baby wants to feed again, but falls asleep. So, how to handle this situation?
Every time the baby is sick, naturally the most comforting person for the baby is the mother. So they tend to be very clingy. It's a very natural, normal process. And since the baby has got a mild fever in the morning, the baby finds it comfortable if he's breastfeeding and if he's holding you and if he's close to you. So that is fine. Please be around your baby. But please, especially in today's world with fever, we are being extremely careful. So please give medicines as prescribed by your doctor. Give medicines to get the fever down. Keep feeding, but continuously breastfeeding is again not good for the baby. So try and disengage when the baby falls asleep, and try to distract when the baby is awake. Plus, this case, I think the baby is not feeling comfortable and not sleeping because he's not well. But we also notice by 6 months, many normal babies also who don't have any problems or infections also tend to get very uneasy in the night because they develop what is known as a stranger anxiety at that time. So by 6 to 7 months, what happens is they always feel that only the mother and the father or who they see very often are going to take care of them, and everybody else who is a stranger are bad people and they will trouble them. So this, even when they wake up even momentarily in the night, if they don't see the people they know, they start feeling that they are alone and somebody has taken them away, and they get bad dreams and things like that. So the sleep pattern normally also changes for children between 6 to 9 months, and stranger anxiety and separation anxiety are the normally developing milestones which the baby is getting. So what I recommend is by 6 months to try and pat your baby back to sleep when he wakes up in the night. Now, this is not related to the baby who is sick. For that baby, the mother has to be around. But otherwise, try to pat the baby when he wakes up in the night and starts crying, so he knows that you are around and he will go back to sleep. Also, don't get into the habit of just feeding so that the baby falls asleep, because that is not really required. If you know your baby is hungry, please feed. Even in the night when he wakes up, if he's hungry, please feed. But just because if he's on the breast and he's falling asleep, that habit shouldn't be formed. So disengaging the child intermittently in the night from the breast is very important. Constantly feeding throughout the night is a very bad practice.
Thank you, ma'am. Ma'am, Ami is saying, ma'am, I have not given top feed, but I want to start cow milk at least once after 11 months. 11 months is completed. Is it okay, or should I wait till 1 year?
So it's most ideal if you introduce any animal milk for 1 year. So after 1 year complete, you can introduce cow's milk for your baby. Before that, a small amount of milk may be used for making the food. Like for example, if you're making porridge or something, because the amount of milk that you're going to use is small. But if you need to give the baby a proper amount of feed to drink, then please wait till 1 year. And after 1 year, do not dilute the milk. You can give the milk as it is. You can use whichever brand of milk that you want to give, but please make sure that the fat content is only about 4 to 5%. Don't give the very high fat content milk because it baby. Can you hear me?
We lost you in between. I think, yes, now you're back.
Yeah, I think I just said the same thing. Yeah, I just said the same thing, that you give cow's milk after 1 year and without any dilution. That is better. Wait for 1 more month.
Okay, fat content should be 4 to 5. Uh, okay. Okay. Ma'am, one
Sorry.
question by. Okay, Saubhagya has a question for you. My baby is 5.5 months old and he's not accepting breastfeeding when he is awake. He only accepts breast milk once he is sleepy. how to feed him when he is awake. I tried dark room. He searches small ray of light in that room as well.
So it's only going to be by a process of trying, keep trying, because if the baby is able to suck in the night when he's sleeping, that means he can suck, and therefore you should be able to suck in the day. Sometimes babies also go through this phase. There is no definite reason for it, but it just happens over a period of 10 to 15 days, and they get back to their schedule. So all I can say is keep trying, Saubhagya. Definitely he will start feeding again.
Thank you, ma'am. I see a question here. My family members suggested that I use homeopathy medicine for teething. So, is it safe?
So yes, there is Dentonic available, but I am not an expert in homeopathy. I am an allopathic doctor, so I don't think I am at a position to say yes or no. But I really don't feel that it is required. It is not only that it is not needed, but it is, if it is given, it is also harmless. So harmless and useless is what I can say. But of course, I am not an authority in homeopathy, so you can ask your homeopathy doctor. From allopathy point of view, there are no medicines required. The child is going to have teething normally and naturally. But if there is any deficiency noticed, or if the mother is not having adequate breast milk, or the mother baby's milk intake is not very good, then we do prescribe calcium and vitamin D containing preparations to these babies so that the teeth come out healthy. But for teething, there is no allopathic medicine required.
Thank you, ma'am. Ma'am, Afroj is asking, since you mentioned, you should not use breastfeeding as a sleep prop, right? So she's saying, how can I train my baby to sleep without breastfeeding? Because he tends to fall asleep only while breastfeeding.
So this now depends on the age. There are various ways that we teach our mothers how to put their children to sleep. So the basically by 3 to 6 months, the child develops what is known as self-soothing skills. Means what? That the child comes to know what he needs to do in order to go to sleep. So he starts forming these mechanisms by which he knows that if I do this, then I go to sleep. So at that time, 3 to 6 months age, we try to tell the mothers that you finish your feeding, then the baby starts getting sleepy. So you take the baby in your hand, maybe you can sing a lullaby or walk around. And as soon as the baby is a little bit drowsy but not yet fallen asleep, you put the baby on the bed. What do our Indian mothers do? We keep the baby on our lap and keep patting, patting, patting. And even after the baby goes to sleep, we don't want to put the baby down because the baby will get up. So actually, that is not the right way of putting the baby to sleep. When the baby is drowsy enough and you put the baby in the baby starts associating the surrounding of the bed to sleep. So then he learns to fall asleep on his own. That if it is done by the age of 3 to 6 months, eventually the baby learns to sleep on his own without using any self-soothing skills. So he will not need to breastfeed. He will not need to thumb suck. He will not need to put something in his mouth before sleeping. But this cannot be done at 9 months or 1 year when your child already has developed this habit. Breaking this habit is very difficult. So, what I suggest is if your child has already developed the habit of always breastfeeding before sleeping, replace that habit with something else. For example, keep a soft toy or a pillow which the baby likes next to the baby, or let baby hold on to some chadar or just a blanket which the baby likes, any wrapping cloth which the baby likes. Maybe just get into the habit of trying to let the baby hold on to it. So replace it with something else, and over a period of few months, when you are able to replace it, then the child slowly gets the idea that okay, he can sleep even while holding his toy or holding his handkerchief or holding his chadar, and then he won't need to breastfeed. But when I say all this, I always keep tell my mothers that it shouldn't happen that your baby is starving. So you can do all this only when you're sure that the baby has had a good meal just before bedtime. His stomach is full, he's not thirsty, and then you don't give breastfeeding just for going to sleep. It shouldn't happen that because I'm saying all this, that the mother is not breastfeeding and actually the baby is thirsty or hungry. So that shouldn't happen. And even when the child wakes up in the night, even up till 15 months, it is okay to feed in the night. intermittently, not continuously. Somewhere after 15 months, we ask the mothers to stop the night feed, so that by 18 months the night feed is off, and by 18 months we ask the mothers to stop feeding in the day, especially if it is difficult for them, so that slowly the baby is weaned off the breast. So in this process, staged manner, you can get off the process of breastfeeding. But there are many mothers who prefer to feed up till 2 years also, and that's absolutely fine. That depends on how comfortable they are. So I hope that answers the sleep question.
Absolutely, ma'am. Thank you so much, ma'am. I think we've managed to take in all the queries they had, and we've completed the session almost before time. And to
Okay.
all the users, we will see you again in next session, and we will definitely have more sessions with Dr. Aditi so that you can listen to more educational talks from her. And thank you so much, ma'am, for doing this session with us during these tough times. It means a lot to everybody.
Thank you so much. Thank you. And I want to wish all the mothers who are here that they be safe and be at home and take care of your children. You're already doing a good job. So please enjoy your baby. And while you're with your baby, try to forget all the things that are happening around you and around in the world. So your baby is going to give you a lot of happiness and, of course, support as well. So enjoy yourself with your baby.
Thank you, and have a great evening, everybody.